Now, the Brucella and brucellosis are tiny gram-negative coccobacilli, and there's two species, Brucella abortus that you find in cattle and Brucella suis that you find in pigs. Brucellosis, Malta fever, undulant fever, Bang disease. This can be these can be transmitted to humans from infected animals. They'll have a fluctuating pattern of fever that lasts from weeks to a year, but it can be treated with tetracycline combined with rifampin or streptomycin. There is an animal vaccine available, and it is a potential bioweapon. Francisella tularensis or tularemia. This is a zoonotic disease of mammals that are endemic to the northern hemisphere, particularly rabbits. And it can be transmitted if you come in contact with infected animals, water and dust, or bites by ticks and fleas and mosquitoes, vectors. You'll have headache, backache, fever, chills, malaise, and weakness. Causes ulcerative skin lesions, swollen lymph glands, conjunctival inflammation, sore throat, and intestinal disruption. 10% death rate, but it can be treated with gentamicin and streptomycin. There's no vaccine, and it is one of the most infectious of all bacteria, so it is also a potential bioterrorism agent. Bordetella pertussis causes pertussis or whooping cough, and this is a childhood affliction that is communicable. It causes acute respiratory symptom or syndrome, and it can be life-threatening for babies. The reservoir often is an apparently healthy carrier, and it's transmitted by direct contact or inhalation of the aerosols. That's so pitiful. As far as virulence, there are receptors that recognize and bind to the ciliated respiratory epithelial cells. And so you lose that ciliary mechanism and you build up mucus and it blocks your airways. There's also toxins that destroy and dislodge your ciliated cells. The vaccine is DTaP that we discussed in here the other day. And you can see it's on the rise in infants. How high it was 2013 is on the rise. Now, Legionella pneumophila or legionellosis is found in water where there are amoebas. And in 1976, there was an outbreak at an American Legion convention, and 200 people became sick and 29 died. It caused Legionnaire's disease, which is very severe, and also what's called Pontiac fever. Males over 50 are usually targets. It's nosocomial for elderly patients. It's not contagious. Fever, cough, diarrhea, abdominal pain, and there is a pneumonia fatality rate in Legionnaire's disease of 3 to 30%. It can be treated with levofloxacin or azithromycin. The family Enterobacteriaceae. This is gram-negative, of course, and it's small, non-spore-forming rods. You find them in the soil, water, decaying matter, and a lot of times in large bowel of animals. And it's a frequent cause of diarrhea because of enterotoxins. This accounts for about 50% of nosocomial infections. These are the most important enteric opportunists. They are regular straight rods. Most of them have flagella. Oxidase negative They ferment glucose and nitrate reduction, and we divide them into coliforms that are lactose fermenters and non-coliforms that are non-lactose fermenters. The surface antigens contribute to its pathogenicity and they trigger an immune response. The flagellar antigen is H, and the fimbrial or capsule antigen is K, and O is the cell wall antigen or the somatic antigen. But not all species have H and K. All of them have O. And they produce, of course, endotoxins and exotoxins. Which of the following is true of the enterics? All of the above.